Okay, good afternoon, everyone. Really happy to start. We have our amazing host and MEP, Brenda Benefei, here with us. Thank you for joining us. So good afternoon. My name is Mariam Saidi, and on behalf of the Active Citizenship Network, thank you for joining us. And of course, thank you to everyone who is joining us online. Today, we are celebrating the 19th European Patient Rights Day, and this is a day where civil society, patient organizations, some of you I know very well as well, join ACN, the EU branch of Initiative, to highlight, encourage and remind politicians like Mr. Benefei that people are, of course, at the heart of healthcare, something I'm sure you know very much about as well. Today's event is exploring the benefits of health data sharing for patients, healthcare systems and medical research at an EU level. It's supported by the MEP interest group, European Patient Rights and Cross-Border Healthcare, and you're going to hear from two of its co-chairs, and one, of course, is our host, MEP Benefei. Now, I don't think I need to educate anyone here on the key role that data plays to improve healthcare outcomes and how it can supercharge research and innovation. For an individual, we know it can be as simple as the documentation of their health record to improve the efficiency and safety of their treatment. For example, documenting things like allergies or medications that have been taken previously. Data is, though, crucial for decision-making when it comes to long-term chronic conditions, things such as early detection, personalizing treatment or monitoring and research. Now, as we're all very aware, especially MEP Sokol, the rapporteur of the EP report on the European health data space, there is, of course, a balance that must be struck between the right of privacy versus the innovation and the public and policy interest. The use of data must, of course, always be appropriate and with consent, even more so when it comes to the reuse of data. So a quick run through today's agenda. After some opening remarks, speakers from the European Commission and European Parliament will then outline the key role of the European health data space. We'll then have a roundtable on the benefits of data sharing for patients, and we'll then end with some final remarks from the Polish presidency of the EU with Jakub. Just also a reminder to all of our speakers who haven't done so already, we are making a TV Star report. We've interviewed some of you already, so do stay behind after the event if you can, so they can wrap up all of those interviews. So first of all, let me hand over to our host for his opening remarks, the Italian Socialist MEP Brenda Benefei, who's also the co-chair of the MEP interest group, European Patient Rights and Cross-Border Healthcare. Thank you so much.
Thank you very much. It's a great pleasure to welcome you again to the 19th European Patients' Rights Day, organized by the Active Citizenship Network together with a lot of different partners across Europe. Since 2007, this event has served as a key moment to inform, discuss and make concrete commitments to uphold patients' rights across Europe in line with the principles set out by the European Charter of Patients' Rights. Some colleagues will come and participate in the various parts of this discussion. And it's very important to have this discussion now, because we are still in the beginning of this mandate, and we are going to discuss the new multi-annual financial framework. We are going to discuss the priorities of the new mandate still in the next months. So it's especially important that we are here, and I think it's especially timely to have this year's theme, sharing health data for the benefit of patients, healthcare systems and medical research. That is very important in the process of digitization and integration of care across Europe. As some of you might know that I'm the co-rapporteur of the European AI Act. I've been working on digitization. In fact, I'm sorry that due to my institutional commitments linked to this work, I was a couple of minutes late, but I was exactly at the meeting dealing with the acceleration of the digital agenda in EU, which is also including the digitization and digital efficiency of our public health in the interest of patients. The EU institutions have to demonstrate coherence. After COVID, there was a lot of political push to support more healthcare action at European level, fighting together to overcome gaps, to overcome issues on cross-border healthcare and support for patients, to overcome disparities, inequalities in access to care. But we are still far from that. So we need that the European Health Union is not only a title or a almost empty box, but it's filled with initiatives, with actions, with resources that can benefit our patients and the system in general, including the work of the healthcare professionals. This is very much linked. So working on the skill shortage and also the work environment of the healthcare operators is very important for the effect of all of that on the patients. And also we need to fight the concentration of medical capabilities only in some areas of our territories, and so the desertification of medical capabilities in some parts of our territories, in our member states. And this can be dealt with further investment and also by investing in the digital innovation, by strengthening e-health, m-health, and all the instruments that can be used to improve the situation of our healthcare system, putting patients at the center. Clearly, continuity of care, active citizen participation, sharing of data as a public good to ensure timelier, personalized and inclusive care are crucial objectives for the next years of the European Union. Having a functioning healthcare is a crucial part of our social contract. It's crucial for the EU to maintain itself true to its founding values. So I'm really happy that we, again, thanks to all the involved organizations, can bring to the European Parliament in a very crucial moment, as I tried to explain, your voices, so that the debates that we will have in these institutions can be strengthened by the experience, by the knowledge that you are bringing here. So thank you very much, and let's have a good discussion together.
Okay, next I'll give the floor to Mario Novato, who's the director of ACN. Please go ahead.
Thank you, Mariam. Good afternoon and welcome to all of you. First of all, allow me to thank the Italian MEP Brando Benifei for his sensitivity in choosing to host the European celebration of the European Patient Rights Day again this year. This 19th edition, realizing the framework of the European Year of Digital Citizenship Education, is particularly important for, first of all, for the chosen topic, the crucial role, as already said, of health data sharing for patients, healthcare system, medical research. That is extremely on-time initiative. As you know, last March, the regulation of the European Health Data Space entered into force, and this is a topic that naturally recalls the relevance of the European Patient Rights Day, which we have been celebrating since 2007. The whole framework of the European Health Data Space cannot stand without a solid foundation of patients' right protection. This has also very well highlighted in the recent initiative training awareness webinar realized by the European Commission, which I want to thank not only for accepting our invitation today, but also for promoting this relevant initiative. Secondly, we are in the middle of the Polish presidency of the Council of the European Union, to which we extend our sincere thanks for the high political value of their decision to include the issues of patients' rights in their 6-month program, that placing it on the European political agenda. As highlighted in the recently published white paper, Healthcare Policy Recommendation, the willingness to work towards the official recognition of the principle established in the European Charter on Patients' Rights is a key step that has been awaited for years. I'm proud to recall that the European Charter on Patients' Rights, which is at the heart of the day's celebration, has been drafted in 2002 by Active Citizenship Network together with many civic and patient associations from different countries. Since its inception, it has been a benchmark for the protection of patients' rights in Europe, and today, more than ever, its value is also recognized at the institutional level. The Polish presidency decision is most necessary than ever, because without a common framework for patients' rights, the European Health Union, already mentioned, will never be truly complete. It will always be missing its leg of rights. This also applies to the full implementation for the European Health Data Space, which directly involves core rights established in the Charter: the patient's right to access, to innovation, to privacy, to consent, safety, personalization of care. We are proud that after almost 25 years, work is finally underway to formally recognize these rights in the acquis communautaire, so-called. And of course, we reiterate our full support to achieve this goal. A representative of the Polish institutions, which we thank for true patronage received, is here today to talk about the above-mentioned commitment. The third point is related with the official presentation of the interest group European Patient Rights and Cross-Border Healthcare, which is now in its third term, thanks to the vision of many members of the European Parliament who have recognized this political initiative as a contribution for civil society to better represent the health needs of European citizens and to strengthen the focus of European institutions on public health, to reduce the gap between European citizens and European institutions when we talk about health-related issues. The interest group's activities are fully in line with both the recommendation of the Conference of the Future of Europe, which stressed the urgent need for greater European involvement in public health issues, and the recent decision of the European Parliament to set up the ad hoc standing committee SANT, following requests come from the civil society, as written in the document, responding to citizens' expectation, and we work on it. On behalf of the Interest Group Secretariat, we would like to thank MEPS Benifei and SOCOR for agreeing to serve as a co-chairs once again. Now, after this very long but necessary preamble, it's time to introduce to me some useful elements for today's conference. The digitalization of healthcare system has radically changed the way healthcare data is processed, which has become a fundamental resource for disease planning, prevention, treatment. In this regard, we echo the message emerged during the last G7 health meeting realized in Italy last October. Making data available, standardized and harmonized is not simple due to technical cultural challenge related to governance, accountability, data literacy, trust, compliance with data protection rules, security issues. All these aspects are crucial for the protection of patients' rights as well as patient acceptance of new technologies. We also acknowledge the high opportunity cost patients have to bear if the potential of their health data is left untapped. On these issues, we are committed, both at the national but also at the European level, to being recognized as a partner that cooperates to promote rights-based digital health technology regulation, policy and practices. In line with our history, in Italy, for instance, my organization, Città Legislativa, has been increasingly involved in ethics committees, both at national but also at local, regional level, while at the European level, we are involved in several EU-funded projects like Facilitate, which, as we will see shortly, aims to develop an ethical, legal, regulatory framework to enable the return of clinical trial data to trial participants and other healthcare professionals involved in their care. The participation of citizens and patient associations in this initiative ensure that the view of those who will ultimately be involved in the process can be expressed. That said, we know that the most citizens are poorly informed and unaware of the potential and positive effect that could result from the use of health data, both from themselves and for public health. And this is why greater investment and collaboration are needed. The European Health Data Space has introduced a very important principle for citizens, for all of us, data altruism. And we are working to split from data altruism to data solidarity to ensure data serves to public good while respecting patients' rights. However, the potential of the European Health Data Space to improve patients' autonomy over health data face a number of challenges, including the insufficient digital literacy of the European population. Recent data show that only 55% of the European population has at least basic digital skills. And in Italy, the situation is even worse, with only 45% ranking my country among the 5 worst in the European Union. This suggests that despite improved access to health data, people with low digital literacy may find it difficult to navigate electronic health records, understand the information they contain, or fully exercise their rights to restrict access and request rectification of inaccurate or incomplete data. Conclusion, the effective use of health data and public awareness to support decision-making is a key issue. The experience of the COVID-19 pandemic has led to important developments in a very relatively short period. In this context, citizens, patient organization, which has been working like mine for years on citizens' rights in the field of health, are committed to exploring the boundaries between citizens' right to privacy and the promotion of health as a fundamental human right. New strategies should be implemented to protect individuals and their dignity without hindering the use of data to support their care and public health policy. The relationship between health and privacy is a key issue because it involves two of the fundamental rights that are most exposed to development of technology and innovation. Institutional experts and experiences promoted by public and private actors will help us today to better understand where we are heading and the crucial role that civil society organizations, patient advocacy groups can play for a more comprehensive and transparent process for building trust, for ensuring that the needs and perspective of patients are taken into account. I thank you for your attention, and of course, I wish you a fruitful event. Thanks.
Thank you so much. Okay. Next, we have a video message from the Lithuanian Socialist MEP Vytenis Andriukaitis. So please look at the screens.
Ladies and gentlemen, dear colleagues, it is an honor to address you today at the 90th edition of European Patients' Rights Day, a moment I hold close to heart as someone who has long shared your commitment to protecting and promoting patients' rights across Europe. I have supported this important event since my time as European Union Commissioner for Health and Food Safety. I was proud to attend this very important conference in person back in 2016. And I continue to stand with you today, not only as a member of European Parliament, but as a member of the interest group, European Patients' Rights and Cross-Border Healthcare, which I am pleased to say will be officially launched its third consecutive term right here during this conference. My background as a health professional has taught me that cornerstone of good healthcare is trust. And trust is built through transparency, fairness, and empowerment. That's why I believe health data sharing, when done ethically and securely, is not just a technical issue. It is a matter of justice and of better care for every patient. Access to reliable, comprehensive data can transform healthcare. It enables earlier diagnosis, more effective treatment, and better outcomes. It also allows care to follow the patient across systems, across borders, across their life journey. And crucially, it fuels research and innovation that keep Europe at the forefront of public health. In this context, the European health data space marks a turning point. By giving individuals more control over their own data, we are placing patients where they should be, at the center of our healthcare systems. This new framework strengthens rights, promotes transparency, and opens the door to research that is both innovative and ethically grounded. As a member of European Parliament, I see it as my responsibility to protect and advance these rights. That means supporting legislation that ensures robust data protection, modern and inclusive digital infrastructure, and above all, meaningful patient participation in the policies that shape our healthcare future. And I am particularly pleased that the Polish presidency of the Council of the European Union has chosen to place patients' rights at the heart of its program. their intention to bring the European Charter of Patient Rights onto the formal political agenda is a significant and welcome step, one that recognizes the work many of us here contributed to back in 2002 and brings it closer to being officially adopted. Together, we are sharing a European Health Union that treats healthcare not only as a service, but as a shared right. And I will continue to do my part to ensure that patients, real people with real stories, are always the starting point of our discussions. I wish you good conference and thank you.
And I think MEP Andrew Kaitis is a big supporter of AC, and you heard some of those sort of key words that you're going to hear today: trust, transparency, innovation. And he also sort of, spoke about how EHDS could be a turning point. Well, let's go into the legislation now and see if that is the case or not. So what we know about the European Health Data Space is that it is a tool that will allow the EU27 to share data that the EU hopes, of course, will improve overall healthcare and outcomes, foster innovation, and support evidence-based policy making. As I said, we're now going to learn a lot more about the ambition behind the European Health Data Service, and we have two high-level speakers. One of them is here, so we'll start with you first. From the European Commission's DG Sante, please welcome Fulvia Raffaelli. She's the head of Unit C1 Digital Health at the European Commission. Please go ahead.
Thank you very much for inviting me, and I'm very happy to be here with you to celebrate this European Patient Rights Days, because I think it's very important that we always recall the citizens and the citizens that each one of us must be at the center of any of our health policies, well, policies in general, I would say. So yes, I am Fulvia Raffaelli. I've had the honor of leading the Commission team during the negotiation of the European Health Data Space, and now I have the responsibility of implementing that, of course, in close cooperation with many different services within the Commission. And I do feel the pressure of delivering on this such an incredible and new regulation. This is the European Health Data Space is indeed a landmark initiative that redefine how the health data is accessed and used across Europe. With the publication on the official journal and the entering into force on the 26th of March, the European Health Data Space is now every day becoming a reality for each one of us. Of course, one of the core of the EHDS is to empower citizens and enhancing care. And this is to ensure that each one of us will have a secure, seamless access to their personal health data, wherever they are in the EU, free of charge and immediately. It looks like a dream, because in many member states, we're even not yet able actually to access our data across regions. But that's the commitment, that this is what the member states have also committed to make it possible by 2029. The European Health Data Space will enable the efficient and reliable exchange of health data for healthcare and contribute to the continuity of care of citizens across the border. In fact, patients will have access and control their health data wherever they are through My Health.eu infrastructure. This is the digital infrastructure that will connect the different national systems. And not only that will connect the different, but it will also impose those data to be accessible in a European electronic health record exchange format. So a sort of common language that would enable and make it this accessibility of the data really possible. we have been, we also, of course, looking at the proportionality and the pragmatic implementation of that. So we are starting from 5 priority categories of data, and those are the patient summaries, the electronic prescriptions and dispensation, the medical image studies and related reports, the medical test result, including laboratory and other diagnostic report, and the discharge report once you've been in an hospital. Basically, this means that patients will be able to access and share their health record with just a click. And this will allow health professionals to have hands all the health data of patients, providing faster and better diagnosis and treatments, both inside the country and also across border. This really ensure continuity of care across borders, no disruption to treatments, and also a stress-free experience for both the patient and the healthcare providers. Think about an urgent care. In case you would have an accident during your holidays in a different member states than the one where you are registered. Then in this case, the patient summary, including all the key health information like allergies, current medications, medical history, will be accessible by the doctor in the country where you are, of course, with your consent. And this can be life-saving in emergencies and avoid redundant tests or potential medical errors. So indeed, the primary use of health data, it is about patient empowerment, better care, and cross-border access to the health services. And the regulation puts patients first, giving them an enhanced control over their own data and building a system rooted, as we've heard, also needed in transparency, security, and trust. The second objective of the regulation is that this work that we are doing, that actually we will all collectively do it in getting and recording this data at source for the objective of improving the care. They may also benefit us for society as wide as possible. Those data, once anonymized and or pseudonymized, would be made available under very, very safe, structured and secure conditions to the innovators and researchers, allowing those to really enhance the capacity and providing a much better view on the current situation. This is also having in mind, of course, the acceleration into the sectors and the potential AI applications, though, which we are hearing a lot about in these days. As you may know, I mean, AI solution-based needs a lot of data, and the quality, not only the quantity, but the quality of data is crucial to actually ensure that those AI solution-based would be able to really profit and benefit each one of us the moment we are patient and needs help. So the European health data space is also in this context a future looking legislation that actually made Europe ready to that challenge, allowing indeed not only made available an enormous amount of data, but also making those data available in the EU way, meaning with the individual rights fully integrated into the way we provide and we will build up the system for the access to the data. So what next? What next? As I said, the European health data space is now into force. We'll have 2 years now happy to see me, Mr. Sokol, with whom we've shared quite an intense time during the negotiations. So in front of us, we have 2 years to work together with the member states and all the stakeholders to define all the technical specifications that we need to actually making the system up and running. We're working very intensively into the implementing act, and then we'll have 2 years for the member states and all the stakeholders to roll out those technical requirements to be ready for the entry into force of the obligation in 2029. As far as the primary use is concerned, we don't need to wait until then. We do have already a voluntary system. This is My Health at EU, which is up and running. We have 50 member states already connected to the system, and actually getting medicines in Spain, if you have an e-prescription from Finland, is already a reality. And that's we will of course keep working with the member states and with each one of you to make the system ready for 2029. What we also looking at now is setting up the governance for the EHDS, because of course we want to have it as reliable, transparent, and also shared, let's say, governance of the system. That's what trust means. And in 2027, we will set up not only the EHDS board that would, let's say, get together the national digital authorities, but also the stakeholder forum that would actually represent all associations of stakeholders, including, of course, patient associations, to provide inputs and, of course, their point of view in the future development of the European data space. I don't want to say more about it, but of course we really we're really happy to have this dialogue with the society and with the stakeholders that you are representing today, because you are the users, you are at the core, you are really the ones for which we are working on a daily basis. This is very important from a Commission perspective. We don't want a few fancy luxury hospitals to profit of digital infrastructures, but really we do want that transformation to profit to the entire society. Transformation must be fair. We think that the digitalization is one of the elements that would actually be needed to accompany that transformation, and we count also on your support and on a continuous dialogue to get it right from the beginning. Thank you.
Just a quick follow-up question. MEP Brando Fay, who is leaving, thank you so much. He has to go to his next meeting. Thank you so much. So he spoke about the coherence of healthcare policy. Mariano spoke about digital literacy across the EU and how important the digital healthcare system is. I mean, of course, we saw this during the pandemic, how important digitalization was for healthcare. So how have these factors been taken into consideration with this legislation?
Well, digital literacy is something that goes much beyond the healthcare sectors, and we are cooperating very closely with the colleagues responsible to enhance to practice and to put actually work on those actions horizontally. To reduce also the digital gap, generational gap. But as far as the EHDS is concerned, we are working with the member states and also with the contractor to define specific modules, training modules that we would make available to the member states so that they can really have a specific interface with the different categories. Because indeed, indeed, communication is going to be very different if we are addressing the patient, if we are addressing the stakeholders, the healthcare professionals, if we are addressing the hospital managers, and if we are addressing the authority responsible for public health. This would require actually to work also very closely with the member states, considering that the situation is very different. Some member states have already system up and running for a very long period of time. Other ones are starting almost from scratch. So we also need to work very closely with the national authorities that actually are the ones closest to the citizens can better help us in tailor the messages and be sure that each one of us will be, let's say, joined in with an understandable message, clear indications, and practical instructions, let's say, on how to benefit of the services that will make available for the citizens.
And then just one last question. I mean, obviously this goes into force in 2029, so obviously there are a few years to go. But what are your perhaps concerns from the European Commission? You've got this great piece of legislation, but are you worried perhaps that it won't properly be enforced by member states, especially ones that have complex national healthcare systems that also have regional issues as well, lots of regional healthcare systems?
Well, the process is the objective is very ambitious. This is clear, and this project has been the idea of the European health data space came up at the time of the COVID. Actually, it was there before, but it was very clear in the mind of the member states that there was really a need to further integration and facilitate the access to this data for the citizens and for the innovation and research. Member states are very much aware that this is the future, and they are all fully committed. I'm just back from a meeting with the health digital authorities in Poland, in Warsaw, on the auspices of the Polish presidency, and I can confirm that the member states are very much committed to the process. Now, the challenges are big. Also, the resource that the setting up of the project requires are huge. This is something that is already ongoing, where member states needs to actually really take up the challenges of redesigning their healthcare sectors. That modernization is ongoing, and the digitalization of the healthcare sector is a key element. So what we need to ensure is that member states have already the EHDS in mind, so that when investing into the healthcare sectors, they do already with the objectives of the regulation in mind. But I think that this is the way they are doing, and they are very much involved into the process. So yes, it's going to be complicated, and it's going to be challenged. It requires a lot of resources, but I'm really, really optimistic about the fact that we will manage, and on time.
Very much. Thank you. Okay, well, let's now talk to, as you were saying, someone who you worked with very closely, EPP Croatian MEP Tomislav Sokol, who is the co-chair of the MEP Interest Group, European Patient Rights and Cross-Border Healthcare. And as you were saying, he was the EP rapporteur for the report on EHDS. Please go ahead.
Thank you very much. First, I have to apologize for not being able to stay longer because I have another event that I'm hosting on the EHDS. So I think you can excuse me for that. But thank you for inviting me. I'm glad that we are having this discussion further, especially the Patients' Rights Day, because the main beneficiaries of the whole thing should be the patients. And in all of the discussions, technical details, questions of secondary use, industries, interests, etc., this main priority, main purpose kind of sometimes loses itself. So I think I will focus my presentation on the actual benefits for the patients. And what you know, so we have primary and secondary use of data. So primary use of data is use of data by healthcare professionals who are treating patients. And secondary use of data is the reuse of that data for other purposes, for research, for policy making, etc., etc. So when we speak about benefits for patients, Obviously, primary use is the first one because it's direct. It directly affects their health treatment. But of course, secondary use of data in a more indirect way also benefits patients as well. So the idea of primary use is obviously that we digitalize the health data, patient summaries, medical charts, etc. So all of the health data. So we go beyond and wider than what we already have in some member states. So we digitalize it and we make sure that this data can be used by healthcare professionals anywhere in the EU. So if you are a patient, if you travel to another member state as a student, as a researcher on a business trip, or even if you go to another region in your own member state, where sometimes interoperability and the exchange of data is a problem, your data will be available for healthcare professionals who are treating you, so that they will be able to see your entire medical history, the medications that you are using, allergies that you might have. So the whole idea is not to duplicate things, that they can see all of your health data and prescribe diagnosis, treatment, or whatever in a much faster and more efficient way than before. Obviously, the benefit for patients is to get healthcare diagnostics, to get health treatment faster and better, especially those who are mobile. But especially who are mobile between different member states, but also within the same member state itself. But what is also important is that by doing this, we're actually giving patients the right and control over their data. So the idea is that the patients also have access to their data, full access to the data, maybe for the first time in some member states. You know that there can be problems in that sense, but also we give them the right to limit access to this data to anybody else. So, for instance, if you have some kind of a mental health condition or anything else that you don't want to share with some of the professionals that are treating you, you will be able to restrict that access. I think this is very important. This can be bypassed in some cases, but only in extreme cases. If there is a health emergency, health need, for instance, patient needs to be operated on, he or she is unconscious, does not communicate, and you need to make a decision fast. So it could be bypassed in this very, very limited number of situations. Also, those patients who, and that's also connected with digital literacy that we have to invest in. But still, if there are some patients, maybe these could be elderly patients, for instance, who are not comfortable about their data being shared, etc. For digital purposes, they can make such a decision. So they can make a decision that only their healthcare professional has access to their digital electronic health record, and that it cannot be shared with anybody else. So in that sense, obviously, also we are strengthening patients' rights and control over their own data. And I think in many cases, in many member states, this will actually result in patients having much more control and access to their own data than they have now. So, and we give them the freedom to decide about everything which is important. So that's the first point. The second point is the secondary use of data. As I said, this is the idea that the data sets that are lying unused, unutilized, they are not structured, they're not systematized, that now they will be systematized and cataloged. These catalogs will be made publicly available, and anybody who wants to access this data for research purposes, for instance, will be able to access this data. For instance, if you have a data set on pancreatic cancer in Rome, and a researcher from Berlin who is doing research on that topic can make a request to Italian health data access body and then get access to this data. Of course, what is important are also safeguards, because the patient trust is crucial. So what we wanted to make sure that there are enough safeguards that patients' data could not be misused, could not be stolen, and could not be manipulated on. So for that reason, so first, what was important for us is to clearly define purposes for which data can be used, to narrow it down as much as possible, because there were some concerns that big tech companies will take this data and use it for social media profiling or something like that. So we made it clear that this data can only be used for public interest purposes, for the reasons of public health. I think that is very important. Second thing is also that this data cannot be downloaded and taken by anybody. So when a request is made, those who make a request to access data have to prove to the public health data access body that they will conduct research, for instance, research in public interest. They can access it only in secured environment, and this data can only be anonymized or pseudonymized. There is a clear prohibition that this data must not be used to identify individual patients. So also by doing that, we are putting all of these safeguards to make sure that nobody can take this data with them and do anything and misuse it for any kind of purpose. So I think so. So these were the most important things for us to make sure that the data is protected, that the data cannot be manipulated. And of course, the big thing, the big issue that was almost the reason why the negotiations could have broken down, but they didn't in the end, was the question of the opt-out. So the opt-out, so the idea was that for the parliament to make clear, because in the original proposal that was not clearly prescribed, that those patients who don't want their data to be used for secondary purposes could make such a decision. So this is what we insisted on, and what we insisted on is that this is mandatory and harmonized. So that means that we have a common European system, and not that every member state can decide on its own what to do. Because if that was the case, then in the end we would have 27 different legal systems and 27 different sets of patient rights that would have been unacceptable. So the end result was that we have a mandatory system, we have a common European system, but in extreme cases like health emergencies, etc., member states can diverge and could bypass the opt-out, but they have to justify it. So it's not a complete discretion, complete freedom, but they have to justify it. Reasons are stated in the regulation. There has to be proportionality, which means that if they want to bypass the opt-out, that it can be done only in those situations. So there is no other way to achieve the public health interest. And finally, this is subject to judicial control. So if there is any kind of problem, then you can go. Then the patient. Then the patient could go to the patient, an interested person, could go to court and challenge this in front of the court. So in the end, we were able to find an agreement also with the council in that way, that we have the one common legal system for all European patients, and that we don't have first and second class citizens with different sets of rights depending on the member state in which they live. So I think that this will be a real breakthrough. I think patients will benefit strongly from this. What we need to do now in these 4 to 6 years in which most important provisions will become operational, is to really inform the patients, the healthcare professionals, the institutions on what EHDS is, because I think 99.99% of people in EU have never heard of it. So we have to inform people, we have to prepare the system, we have to train healthcare professionals and those people who will be using the data and controlling the data, so to make sure that when this whole thing starts, that there are no shocks, that there are no surprises, that everybody is already prepared to do that. And if we are able to get it right, I think there will be a lot of benefits for everybody. So thanks.
Is it a bit slightly ironic that member states can opt out of the opt-out?
A bit, yes, but we have to be flexible, because there are extreme circumstances, like for instance pandemia, where definitely you need to have this kind of additional possibility, because sometimes interests of the community outweigh the interests of the individual. So that's the whole idea. Remember what the situation was with COVID, because for instance, if it is a contagious disease, you're not just jeopardizing yourself, but if you don't share data, people don't know that you carry a disease, then you are jeopardizing the community, you're jeopardizing the other people. So for that reason, the idea is to also make it possible to protect the community in extreme circumstances as well.
Okay, thank you. Very well said. And then just a quick sort of follow-up question then. A question I know has been asked you before, where someone said, is health about economics, or is it about human rights? So do you think EHDS has found the right balance between privacy and the use of data, so that health does both, that it safeguards human rights, but also economic benefits?
Definitely. So I wouldn't have signed off on the whole thing if I didn't think that. Of course, it's never ideal. There are always possibilities to make things better, but I think in general, yes. So the whole idea is, for instance, so that we already mentioned all the safeguards. So narrowly prescribing the purposes, so anonymization, pseudonymization, prohibition with penalties for the misuse of data, controlled environment, etc., etc. The opt-out as well. But the crucial thing was, again, with the opt-out, so how to make sure that you get data which is useful for research, for innovation, not just for companies. It can be for basic research. It can be for universities, for instance, etc. But everybody's always focused on the industry. I understand that. So the idea was that we have an opt-out, which is that the opt-out actually makes it possible for us to give patients right to decide on one side and to protect their right to choose and privacy, obviously, and on the other side that we also give those who want to use the data which is useful and which is not biased, which is representative. And we have studies which show us that there's a big difference between an opt-out and an opt-in. In an opt-in, you get data which is, in most cases, not representative and not useful, but with an opt-out, the situation is much better. So I think this was the crucial thing where we had to strike this balance, and I think we were able to do that. So maybe it's not ideal, it's not perfect for everybody, but I think always you have to make certain compromises to have the end result. But I think I'm satisfied with the end result in the end.
Okay, thank you very much. And so now we'll move over to the multi-stakeholder roundtable. MP Sokol, if you'd like to say anything during that discussion, please let us know. You have to leave as well. All these MEPs are so busy today. Okay, well, we thank you so much. Thank you so much. Okay, goodbye, MP Sokol. Okay, so we'll start our roundtable then, and here we're discussing the benefits of sharing and returning health data to patients. And this will, of course, include a Q&A if there's time, but I don't think there's going to be at this point, but we'll try. So I'll allow everyone to take the floor for some introductory remarks, and then we'll come to some questions. So joining us for the debate, they are the ladies and gentlemen in front of me. So Joanna Bloom, she's a professor of psychobiology, pediatric and behavioral neuroscience at the University of Modena and IHI Facilitate Coordinator. We have Birgit Bauer, who's the digital health and social media expert, patient expert and coordinator of Data Saves Lives Germany. Next, we have Anieta Tiszkiewicz, the Director of Digital and Data at the European Federation of Pharmaceutical Industries and Associations, as we know as FPA. We have Marco Korniak, the President of European Liver Patients Association. Last but not least, we have Sarah Farina, who's the Resident in Hygiene, Preventative Medicine and Public Health at the Universidad Católica del Sacro Cuore, also from the Profit Project team, which is a personalized prevention roadmap for the future of healthcare. Okay, well, welcome all of you. So we'll go in order of introduction. So I'll start with Joanna first.
Chance to introduce. Okay, so yeah, my name is Johanna Blom, and I have the privilege of guiding and coordinating the Facilitate project. Facilitate project is an IMI-JU project, so it is a joint undertaking of private and public partnership, and that's where the strengths are and also the difficulties when we get into that. I'm a physician as well, and so I deal with patients, and I'm a pediatric oncologist or doing their long-term follow-up. So what happens to data and how patients have access is, for me, very important, and that's why working in Facilitate is such an important part of my current efforts.
Would you like to perhaps explain a little bit about the Facilitate project so everyone can understand?
The Facilitate project is about creating an ethical legal framework to make it possible to return individual participant data and share data for secondary use in clinical trials. And that makes it different from the European health data space because it's a subset. Actually, or in the future, it might become a subset because we talk about research. It's not easily accessible because we're dealing with industrial sponsors, we're dealing with the rigor that is necessary in order to return data. Returning individual participant data is not a mandate right now, but it is becoming a moral imperative. Patients and participants in clinical trial are asking for that. Now, what we have done in Facilitate is taking it one step further. And what we have, after 3 years, arrived at is creating a framework that is return of individual participant data by design. That means that it is there from the start. It is incorporated in the clinical trial design. That also means that patients and participants to clinical trials are there from the onset and have a right to sit on the table. They are partners in this enterprise. And what has been interesting in our endeavor is finding industry as partners and thinking with us, not as a one fits all, but with their resources and their availability, they are willing to think about flexible solutions. It's like building, designing an apartment building with different floor plans. Everybody buys into having a kitchen and bathroom, and but how you're going to do it is different. What needs to be done is that the patient is there from the start, that they have a say, that they know when and how they can access their data. And it is an interesting process because as it is designed, it is incorporated, it is an invitation, and the patient decides how and when to access their data. So they are returned. It's not a data dump. It is organized in a way that is pertinent to the clinical trial and pertinent to a specific patient population.
Thank you so much. And we'll come and we'll speak to you a bit more shortly. Birgit, over to you. Yeah.
Thank you for the invitation today. And thank you for the kind introduction. Our mission from Data Saves Lives, and I want to start here, is to strengthen an understanding of health data, digital health, and independently, objectively, and in close dialogue with patients and citizen communities. Personally, I'm a big fan of the European health data space and also from health data sharing, because it's important for us, as it was mentioned already, the European electronic health record, exchange format and things like that, what makes it easier to communicate and also to travel for us patients. And as a patient expert, I'm experienced at the moment a little relapse with my multiple sclerosis, and I would be happy to go in Brussels to a hospital to find out what I can do. So I'm the living example for the moment, but it's okay. So I'm under control. But what we have here and what I see is also, and it was so often said, we need to strengthen the digital health and data literacy of the people and the patients. This is a must-have. And as I heard Mr. Sokol speaking about that, I was asking myself, why didn't we have started it yet? Because we are coming around. We are talking about so much, but we are close. We are just talking in close communities or in so-called expert bubbles. We need those transparent communication, and we have to educate and inform the people in a very, very good way. Also that they can say, okay, I'm coming with you because I'm excited as maybe I'm excited. And we also have to make sure that people understand why we need primary use of secondary health data and also the secondary use of health data, because it helps. And by the way, just to make sure, as we had the theme of economic issues, yes, it can also help to reduce cost in our health systems. And as a person coming from one of the most, I would say, attacked health systems at the moment we have from Germany, we have to pay more and more money for, I don't know what, nothing. This is the consequence of that. Therefore, we need also to respect these issues. But I want to come to three key pillars of success when we want to come to the European health data space. And this is what we are doing at Data Saves Lives. Patients and citizens need and deserve, for example, for sure, need clear, accessible, and transparent information. I know you have heard this today for many times already, but I think it's really important to talk about the benefits and the risk of health data sharing, also that they can make a decision in a better way. Also, they need, when we ask them to share their health data, we also have to give back something information, maybe also insights and results when we work with patients, also to make sure that they can make better decisions as a consequence. This is a very important point for me. Second point is communication. Different people need different communication. We don't understand everything what people are talking about. Some have more literacy, some have less. Patients often see the benefits and are open to contributing, while many healthy individuals ask why they should share their health data for free and worry about privacy. This is what I experience very often also in our Data Saves Lives community. The healthy people say, why should I do this? And the patients say, yeah, we are open, please let us help, because we need solutions, we need better research, we need better medications, and therefore we want to share the health data. And therefore, or that's why we need clear, respect for and regular communication to explain what health data matters, and also how it's used and what is happening with it now. And also with strong, clear messages we can build, we heard it already, trust, and increase data literacy again. One issue is awareness outside the expert circles, and I have said that already. Very few people don't even know what the EHDS is. We need better communication also to explain it to them, very targeted, direct, and in different formats to reach the public. And that means not digitally, also in newspapers or TV shows and so on. So we need a concrete strategy to communicate in a very broad range. What we are doing with Data Saves Lives is we inspire also not just patients and citizens to inform themselves. We inspire the people and also the experts how to communicate. And this is, sorry for the advertisement, this is our new magazine, what we have. It's free to download on our website or here available with a few magazines. But what we have done is to explain how communication could be. And we bring different opinions of stakeholders together in this magazine. And last but not least, I want to come to participation. Let the people be part of it. Why not? So it was said already here, but I think it's very important to give people the chance to give their overview, to give their maybe also their opinion to something, and also let them contribute. They have something to say, especially patients. They have a lot of experiences, maybe also thoughts in their minds. They could contribute to this. And to say it so, they can be also an ambassador for the EHDS. Because they are informed then, they can share the news also with the network. So as a communications expert speaking, we also build a community here, and we also do capacity building to spread the word and grow the reach of the European health data space a bit more. So, and by the way, TDAS too, maybe some of you might know this, does that already with public consultation, but the issue here is also not all knows about it. Not all can contribute because their opinion is not there, and the news are not there that it is running. And that gives us the link to the communication, participation, and also information strategy. And I think together, we as a society can form a foundation for a real good progress. And I know that because I'm also a part of the Expand DH program and also about a European funded data labeling project, and I see the need of this communication, and let's do it together in that way. Because far too many are still left out of this conversation. And that's why we have to do this. We have to inform, we have to involve, and we let them participate. And above all, let's listen to them, because they have a lot of knowledge we can use also to create a better European health data space. Thank you very much.
Really nicely said. I'll come to your questions a bit later. Next we'll go to Agneta.
Thank you very much. Good afternoon, everyone. A lot already has been said. I am representing the innovative industry, innovative research industry. We represent over 2,000 companies operating in Europe, companies of all sizes. We are very closely following the discussion during the negotiation of the European health data space. The main reason for that is in order to generate evidence on medicinal products, in order to make sure that the medicines that then the patients are taking are safe, that are effective. We need to have access to data that then it's turned into insights and eventually into knowledge. The knowledge about the therapeutic areas where the options are for treatments are currently non-existent or non-satisfactory. So basically data is critical at every single stage of medicine life cycle. It does not end at the moment of medicinal approval. We still continue, and we have obligation to do a longitudinal follow-up to see the results of the treatment in the long term, to monitor disease progression, treatment patterns, and its impact on the society. Hence, although historically we mainly used the data or collected the data in randomized clinical trials in a strictly controlled environment, now with the availability of the new sources of data, with the technological advancements, with the analytical ability, we look more and more into using the data from real world. And that's mainly because of the fact that it gets us closer to the patient. It allows us to gather the insights that are more relevant to patient. It shows us the real added value of the treatment in diverse population in real life. It's also a fuel for further use of innovative approaches such as artificial intelligence, which has also sort of a great potential to revolutionize the way how the medicines are discovered, developed, and delivered to the patient. So from this perspective, we were a strong advocate for the creation of the system that would simplify the access pathways to data and eventually would improve its quality at source. European health data space aims to create such a single market for data that will provide us with one-stop shop in every single member state to access the data. The access to data will not address the issue with the quality of the data with its suitability to be used for the scientific purposes. It's worth highlighting that any evidence that is generated in the context of development of medicinal products needs to live up to the very well-defined high scientific standards. Hence, when we access the data, we still need to apply methodologies in order to make sure that this data is really, that the insights are really reliable. So that's something that EHDS will certainly not address. Although, as I said, having this improved healthcare information infrastructure and streamlined pathways for accessing the data, it's an absolutely great sort of way forward. But here we are also mainly talking about the patients, and we are operating in a very highly regulated sector, rightfully so, because we work with a highly sensitive data. We work with the patient's data to inform decisions that are having an impact on patients, on people's health. Hence, from our perspective, it's very important that data is always processed in an ethical, lawful manner. And the companies are obliged to apply very well-defined governance mechanism on how the data is being processed internally. And we are slightly concerned that in the European health data space, we see more and more voices saying that more and more conversation is shifting to the privacy-related aspects. And we talk about safeguards, but we don't really talk what are the safeguards. For example, we don't say that most of the data to be shared to be anonymized data. So I think this is a really an important factor, because it would be sort of a backbone for the EHDS. If the patient would trust the system, if the system would merit their trust, and from our perspective, if patient would start opting out, this would introduce variability into the data sets, and it would reduce the usefulness of these databases in the scientific research. Hence, we will not use the EHDS if that would be the case. So that would go against its main objective. So definitely a more broader communication in that context is needed, and I would very much agree with previous speakers. The communication about the value. We talked about altruism, how to find a balance between the data altruism, data privacy, and at the same time advancing sort of public health. That's a sort of a question to be further answered. We talk also a bit about transparency, which is usually kind of brought up as an important factor of kind of generating greater trust. We actually did some study recently monitoring different disclosure mechanisms, and it turned up that there is no indicators measuring its impact. So we are actually asking for more transparency, but we are not even looking whether the data that is currently being disclosed is actually reaching out to the society and impacting on public perception of how this data is being used. So definitely this is the right way forward. This is also in a broader context of competitiveness and achieving greater productivity. It's a very timely and needed initiative, although there is still definitely quite a lot of work needs to be done together with all stakeholders, building also on good practices that already also exist. I think I would end on that. Thank you.
Okay, next to Marco.
Yes, thank you very much for the floor. I mean, I changed my introduction like several times now. Luckily, we don't have any more speakers. Yeah, so I would like to, first of all, thanks for the invitation and a big congratulations on Mr. Volta for excellent discussions. I really enjoy all the discussions because I'm looking at from the viewpoint of a patient. So I'm the president of European Liver Patient Association. I'm a patient with a rare blood disease. We have like 13 people in Slovenia that are living with the same disease. So you can imagine, I go to the healthcare providers and they do not know the name of the disease or whatever to do. So I would like to talk to you about three things now after this discussion. One is the understandable data. The second one is the trust. And the third one is patient-centered systems. So understandable data. I really like the idea that patients will be able to access data. But when I don't know what to do, I refer to my mom, for example. My mom is 60 plus. So she has the access to electronic database. She can see what is there, but she does not understand it. So I would be really keen on having a system that would explain what are you looking at, because my mom then goes to Google. And if you Google too long, you have like terminal cancer in 5 minutes. So it would be really nice to have like access to your data, but then also some kind of a expert who will help you to understand what you are reading or what you have access to. The second one is trust. So after COVID, we saw that the trust of patients in the healthcare systems had been lowered, mainly because during the COVID, the governments, they were like closing up and they were like sharing data among themselves and to the general public. They didn't use a vast networks of patient communities that they had at their disposal. So hopefully in the next pandemic, in hopefully 100 years, but maybe sooner, it would be really smart to use the networks that we already have built up. So we have patients that have built up patient groups, that had educated patient groups. The patient groups can also share data to their patient groups, and they can also share data to general public. Just to give an example, so like 10 years ago, we were 0 on social media. Now for 3 years in a row, we exceeded 1.5 billion impressions on social media. So you can build up something that people will be interested in to listen to. And the third part I want to talk about to you is the patient-centered system. So I'm super happy. I will start as a new active director of the Public Agency of Republic Slovenia for Quality in Healthcare. So we will have zero tolerance for not having a quality healthcare to our citizens, mainly because the leader of the agency is a patient with a rare disease who has to visit hospital 2 times per week. So I know what they're doing, and we will try to improve the system. So I think that that was a step into the right direction for Slovenian government, at least, to put patients into the leading roles in order to ensure that we are really building a patient-centric system. So with that, I will end my introduction. Hope for some good questions. Thanks.
Well, I'll try. Okay, Sarah, please, next.
Thank you very much. And unfortunately, Marco, I was the very last one speaking. So, but I mean, all the words I am hearing today are inspiring. So it's a pleasure. I will focus on prevention, okay? That I know it's the first point of the Patients' Rights Charter. So I think it's the center and probably is the most powerful tool we have in public health. But I think that in my experience, in what I do in my everyday job, personalized prevention represents the next essential step in order to make prevention more effective, more accurate, more precise, and this is true, especially when it comes to chronic diseases. Think about cancer, think about neurological diseases, think about cardiovascular diseases, diabetes, and these diseases, non-communicable diseases, we call them like this, and they are caused by several risk factors, and these make it harder, okay, to do prevention. We in public health usually hear about vaccination, maybe screening programs, but primary prevention, which is the most important prevention we have that targets healthy people, it's fundamental, okay, in our systems. So this is the main focus of the Prophet project that I'm honored to represent here today. And this is a European funded initiative that lasts 4 years. We are in the 3rd year of the project. And basically, it involves many partners from Europe, 18 partners, and we are honored to have also Cittadinanza Attiva between them. And they're from 13 countries in Europe, okay? And overarching objective is to build and to co-create with stakeholders, with all the stakeholders, a strategic research and innovation agenda, okay, as RIA, and the roadmap to help the health systems in Europe to implement personalized prevention. But what's personalized prevention? We had a very long meeting within the consortium, the Prophet consortium, to have a real definition, okay, aligned with all the definitions we have in literature and in big institutions worldwide. And at the end, we arrived to the conclusion that personalized prevention aims to prevent the onset, progression, and recurrence of diseases, and in our case, chronic diseases, but of course, all the diseases we have. And it's based, and it should use any individual characteristic to design and apply a specific preventive intervention to the individuals, okay? When it comes to data, of course, we're talking about any individual characteristic, but think on how many individual characteristics we have and we can take into account to do a personalized prevention. We're talking about biological data, biological information that can include genetic information, biomarkers, any kind of information regarding our health. And then we have lifestyle, okay? So behavioral data. We have environmental data, the air we breathe every day. And then we have social, cultural, and economic data that differ between every individual, okay? So how can we use all this data? The importance is to combine all this data together in order to have and to obtain a full picture, okay, of the individual risk to develop a disease in the course of our life. So basically, with the integration of all this data, we can create algorithms, and we can use these scores, we call them scores, to, let's say, predict who is more likely to develop a specific disease, a chronic disease in the course of their life. And this way, we can intervene in a precise way, in a timely way, in equitable way. And of course, this should be, we already use all these keywords today, we call them keywords. We need trust, we need transparency, we need the respect of patients' rights. But I've heard a lot about the fact that we need an informed population, an informed public, but who is going to inform public? Often, it's true, we can easily access to a lot of information through the internet, the web, and Google, but I think the first interface we should have is doctors, is our general practitioner. And I can tell you that general practitioner doesn't know anything about personalized prevention, about digital health, and about how to use data, how to share data, primary, secondary use of data. Trust me, it's something that during medical school, nobody teaches us, okay? So I stress this point, and I think that the first target of our training programs should be the healthcare professional in the way that they can transfer these information in the best way to patients and citizens. Thank you.
Okay, so I'm taking the opportunity to invite anyone from the floor who wants to ask a question. Do we have any heroes who want to put up their hands first? Okay, no one seems to put up their hands yet. Okay, so while you're all warming up, there's one. Okay, yeah, please go ahead, yeah.
Hi, thank you for the organization. Thank you to all the speakers. So I am a psychiatrist by training and working at the European Union Drugs Agency. So working in the field of mental health and substance use. When talking about the opt-out, mental health was mentioned as one of the probable reasons, which is often sensible considering, you know, the ongoing stigma around mental health. My worry is that it will indeed be an important reason for opt-out, and that we will have much less mental health data compared to physical health data, and that this will enlarge the gap in knowledge and research and funding between mental and physical health, which is already there. So I'm just wondering if this is something that has been taken into account when discussing the European health data space, and if there are any suggestions for strategies to overcome this.
Thank you. This is a good question that gives me the opportunity to clarify something that is often, let's say, misunderstood. So there are the opt-out, there are two ways of interpreting the opt-out. First of all, there is what is happening in primary care, so what is related to my personal data. And in this case, the patient and the citizen, let's say as such, will be able to obscure, to restrict the access to a number of health, let's say, events that you don't want to share. Mental health is one of the classic cases. So I think that this needs to be very well understood, that then whenever you are accessing data from a person, so where your name on, no? So a full verified data, then you are fully in control because you can actually restrict the access and nobody will see that you have been subject to a mental case or to an abortion or to whatever. So this is what it gives you the control for the primary use. When we're speaking about opt-out, we are speaking about opt-out in general terms from the secondary use. So basically we are speaking about data which are already anonymized and pseudonymized. So in any case, they will not be able to identify, to read. There is a clear, specific obligation, prohibition into the regulation to re-identify the patient. So if you are participating, you're making your data available, even in a case like that one that was described before, nobody will be able to re-identify your data. So to be honest, as a patient, I would be also in a mental, in a situation, let's say, of sexual transmissible disease or whatever kind of non-super, let's say, nice situation to share. It would be in my interest still to share those data with the society to prevent, to help and support the other categories or the other person that would be in my same situation without actually fearing or having having any concern about the possibility of me being recognized. So I think that we need to, this is something that needs to be explained very, very careful to our citizens, that when we're speaking about secondary use of data, it's not my data as full verified that would be playing a role, but just after they have been anonymized or pseudonymized, and definitely there is no possibility to re-identify. What I would also make clear here is that there are very, very strict conditions for the data users to get access to this data. So there's a long process with the data users undergoing quite, let's say, quite a journey to get the permit to have access to this data. And it will only be able to consult the data in a secure processing environment, but those data will never be downloaded, because when you download the data, then you can apply all kind of software for also, and this is the fear of many, that would bring back to re-identification. But those data would never be in the hands of the users. They will stay in the secure processing environment, and they will be just for the innovators and research accessible, and then only the result of the exam or the let's say, or the assessment will be for the research and of this case. So I think it's very, very important to explain that there is a big difference when we're speaking about personal data, meaning, and in this case, I'm not referring to the legal, let's say, definition of personal data, but to really the data that where my name is, let's say, applied, and those data which are made available for research of innovation, which are definitely not, for which is not possible to link it back to the original passion that generated, for which the data were generated to. So I think that's.
Agneta, I'm going to bring you in then. So we're talking about the trust and privacy, and I think MEP Sokol, Marco also brought it up, the sort of generational fear when it comes to sharing data. I think Marco was talking about how it's great that people have access to data, but you brought up, your mother, perhaps she would Google something, she wouldn't be able to understand it. So how much does all of this then impact, the data that industry has access to in terms of your ability to, innovate, research and development, and how perhaps as industry then better build trust in all of this so that we don't have these sort of generational fears when it comes to sharing data?
Yeah, thank you. I think I partially already answered before indeed to that question, but when it comes to the trust in a society about sharing the data with the industry, if that's, maybe we can turn this question around and make it even a bit more controversial. So again, the industry is obliged to be compliant with all of the rules that are existent in the European Union, with GDPR, with good clinical practice, with the clinical trial regulation. Nothing happens during the process of medicine development, delivery to the patient that is not controlled also by, that is not without control of independent authorities as well. We need to have the anonymized data. We only have accredited persons that can access the data. We can only transfer the data in accordance with GDPR. The patient needs to give a consent in the countries where this is necessary. Hence, this is actually the privacy law existent in Europe actually entangles us in a very long privacy compliant negotiations with different authorities that interpret also GDPR differently. Hence, also even before we start even clinical research, there needs to be approval of the ethics committee in order to even collect the data from the patients. Has nothing to notice without appropriate supervision. And maybe that's something that we should also communicate a bit more about. Also, we share the data in accordance with the EU law. We also, the companies share the data voluntarily, also at the platforms such as Yora or Vivli. Again, nobody is really measuring whether that's truly changes the people's perception on how the data is being used. So that's something I think that is interesting to look at, because we're asking for more transparency, but we're not using current mechanism to actually increase people's trust in data sharing, to actually maybe to inform people about what is happening with the data. So specifically with the EHDS, I don't think that we should protect the data more than we protect patients. So that's maybe from this perspective, we need to remember for which purpose this data is specifically used, what sort of type of safeguarding mechanism would be applied. And we are definitely, as I said, very concerned that the opt-out in the HDS can be applied differently in different member states. That would create GDPR 2.0 rather than having a harmonized system. We are concerned that this is, as MEP Sokol said, it can be actually overruled by the member states, but it cannot be overruled in the context of data sharing with private companies. So in any case, we will not have access to data if the patients would decide that. So that's also to reassure people that this is disclosed, also to differentiate public and private authorities. Although when there is an emergency, we also play a critical role in also developing appropriate solutions. So definitely we would want to minimize the impact of opt-out in the future EHDS. How that can be done, again, I think the communication addressing misconception that also still exist.
I would like to answer. I would like to answer or make a comment on the information communication part, because we often talk about difficulty with digital access and the generation divide. But we have another problem. We have a problem with young people. I go into schools and I talk about this, and young adults or almost adults who are going to be users of this system have no idea whatsoever. They are very good with their thumbs and looking at Google. But if you talk about data, their health data, and how to access they actually have no clue. And if we want to change something, we have to start with them. And it's not information and communication. It's education that we need. And if you look at the divide in Europe and you look at literacy, but literacy is underscoring health literacy. We have countries in Europe, Italy among them. If you look at the OXA level of being able to read and write and use numbers, they're not. They're actually very poor. And there are many countries in Europe that are in that situation. So what are we talking about? I mean, we are talking about access, trust. They have no idea. But they are the citizens of tomorrow. They are the people that are using this tomorrow. So I think we have to start really at the base also in age-wise.
Marco, you also brought this up. So do you think that perhaps GPs can play a better role in helping people to understand, when they get a test result, what it says to them? Can they do better?
I wish I would say yes. So there was a call from European Commission in order to prepare better societies for a health technology assessment, because in the future we will have different procedures for approving the drugs and also medical equipment. And there were two calls. One was for patient communities and one was for medical communities. So for patient communities, there was a lot of universities who applied, and we had this process of educating patients how to contribute to this space health, so health data in regards of health technology assessment. For the call for medical experts, no one applied. So I think we have a problem there, because from patient communities, this is seen as they already know how to talk to us and how to incorporate our data into all the procedures, which is not always true. So you need to be able to work with patients and to go from their passion to something that you really need for the procedure. And this cannot be just one-sided road. So you need also educate general practitioners or other doctors. I don't know if I can bring in another topic, because you gave me the floor. So because I heard something like getting something back. So I don't know if you know, but patient communities, we really try to motivate our patients to be active, to do something, but then they have nothing in return. Just let me give you an example. In 2019, European Medicine Agency received 178,000 reports from patients. In 2020, because of the COVID, we got 780,000 reports from the patients about the side effects of the drugs. And 0 of them got any reply, thank you very much for your... So if you go to your national authorities in your countries, you can see that there is a form for medical experts to report something that happened during the procedure with the drug. And there's also something that you can do as a patient. But the problem is that you take half an hour to do all the different things to write in, you send it somewhere and it's lost. So it would be great if you are sharing data as a patient to get something back. I'm not talking about, financial overview or whatever. I'm talking just like a simple thank you very much, or your data was shared here and here, or your data has improved this data for this research. So something that would be really nice to have back. Thanks.
Just an anecdote. I'm going to my GP, and guess what I'm doing? I'm explaining him digital health and the EHDS instead of he giving me advice how to do it. And this is the case I hear so often from our communities. So I think a HCP is an HCP, a doctor is a doctor, to explain me my symptoms, to give me advice how to take therapy or whatever. It's a medical thing, but digitalization, there is no time for this. I have 10 minutes with a neurologist per year. How should he explain me, please? Yeah, you have to do the EHDS and you have to share your health data. And by the way, we have some digital app that could be interesting for you. Sorry, I'm out of here. I think we have to make sure that the people clarifying these themes and doing educational stuff and informing. And this is what we also see at Data Saves Lives. People want to have these explanations, but not from their doctors. They say very clear, I want to have my doctor to explain me my disease, but not digital health. There we need other, I would say, places, people, experts to do this. And regarding your thing, so give something back to the patients, information, it's not enough to take the data, and this is really serious, and do nothing with it or give nothing back. So I had a discussion a few weeks ago also with some industry members and other experts, and they said to me, well, if you give your data, that's good because you help others. But at the end, I said, what can give you back? And they said, well, you can maybe have a blockbuster or a new medication in 10 to 15 years. I'm sorry, I'm too old for this. I want to have my information now. So I'm over 50, and maybe in 15 years, I don't need a new medication anymore. And many others have the same problem. So I think we need really to give something back, no matter if it's a adherence, a medication event reporting or something else. So we have to make sure that it comes back quick, not maybe in 10 years or so. Thank you.
Thank you very much. My name is Luc Nicolas. I'm coming from ETEL, European Health Telematics Association, existing since a bit more than 20 years. And actually, I think in terms of communication, what we really need is something easy for people to understand. So in one of the projects funded by the Commission, the X-Chair project, we try to give something very simple in the name of a so-called yellow button, which would be basically a very clear signal on all devices and all personal health records in the hands of the patient to see that if you activate this button, you have access to your data and you can activate those data, and those data are EHR X-file compliant. So they mean they are structured, they are coded, can be reused. And I really believe that we need that to push it, because indeed, we can't rely on healthcare professionals to do the job. And we need to have simple communication tools to communicate to those people. So I really believe in the concept personally, because I think it has been a very powerful mean to do that in the States for different reasons. With the blue button, here it's much more ambitious, this yellow button, than the blue button was, but that was a communication success in the States. Why can't we do it in Europe? The second thing I would just like to ask the question is about the anonymous data and the contribution of citizens. We see with the long COVID that we have been missing so many patients who are today still affected by long COVID. And basically, we have such a difficulty to identify them in the system. We have now with the opportunity to better identify them through this contribution of the patient, the capacity of the patient to contribute their data and to be surveyed in a way, in a direct way. So let's be clear. EHDS will provide a powerful tool, but GDPR will remain also needed. So we need to work on two levels because we will need longitudinal data. We will need pseudonymized data for a number of use cases which are not necessarily covered. So beyond the opt-out different interpretation, let's not forget the GDPR. It will remain useful for quite a number of use cases.
No, thank you. I think all you said is very clear, and we have that very clear in mind. On communication, I said it myself, that is maybe the most difficult part of the exercise here. What I would like to say is that, of course, we need to be very clear what can be done at European level and what is to be done at member states level, because at the end of the day, the interface from a citizen perspective, you will not have anything to be done at the European level. Your interface daily direct will be with your national portal, so that it's your national portal that is giving you access to all the services, including the cross-border one. So there are no two different, one for when I go on holidays and one when I am going just to next door. So it's the same system, and that's it is very important. So there are indeed a number of, it's very important, the communication to make it clear what are the rights, what are the rights for a patient, as I said, both at primary and secondary level. But we need also to be very clear that this is not an opt-in system. So you are in by default. And it's basically, the idea is to inform about the, this applies in the two cases, so primary and secondary, is that there's nothing that you need to do as a patient to enter the system. Okay, your data, whenever they are digitally recorded, because as such in the EHDS there are no obligations to digitalize the data. So this again, it stays with the member states, but the obligation is with the EHDS is that whenever your health data are digitalized and recorded anywhere, they would need immediate accessible to you. This is the obligation, and there is nothing that you need to do. This is an obligation for the member states to make it possible. And the same when it goes to that. Then once they're there, then you can decide if you want to restrict, as in the case we mentioned before. If you want to, you will have a clear visibility and traceability of who is having access to your data, why, when, and for what kind of reasons. So this you will be able to follow everything. But as I said, as such, you don't need to do anything. So that's it's an important setting. And the same goes for the secondary. So the secondary, you are in by default, and your data are made available under the conditions we explained before for the research, for the policy making afterwards, unless you opt out. So you have to take an action if you do not want to be part of the system. So I think that this is something that we need also to realize. So we're not also for the GP as a person. I mean, it's important for him to understand how much more information he would have and how to actually assess, how to use, how to visualize that information. But as such, we're not adding anything on top of the for the GPs. This again, it would be for the member states to decide whether they want the GPs to actually record everything or to have a report after each one of the. So this remains with the member states, and we're not going to impose a way across Europe. I mean, traditions are very different, and this will remain as it is. So we are just building upon the traditions and the different strategies that are very much in the member states, not only because we have no power according to the treaty, but indeed because also these are very different ways the doctors are trained into the system, etc., etc. So this is really a matter of subsidiarity, and we don't want to enter into it. So yes, there is a big need of communication. Now we also try to make the system as simple as possible and relying really much on what is already ongoing at national level. And that's, so we're not just that tomorrow, everybody will have to do and going and do something. I mean, this is a system that will build upon progressively. In most of the member states, there are already systems to access data for primary use. Bit everywhere. In Belgium, we know Ma Santé RBA. In Italy, we have the fascicolo medico elettronico. So, I mean, we have a bit everywhere platform that exists already. So let's also, be very pragmatic and looking at the way we need, we can build, let's say, on experiences that exist already. I see it as increasing awareness, building upon what we have already, not really a big bang from one day to the next. That's what I see.
Okay, thank you very much. Okay, so we'll wrap up the roundtable because we're running out of time, and apparently there's another meeting that will kick us out in about 10 minutes. So for some final remarks, please welcome the representative from the Polish presidency, Jakub Adamski, the head of cooperation department at the Office of the Commissioner for Patient Rights.
Thank you very much for the invitation. And I'd like to start by joining to the discussion we had in a moment before I'll go for some more formal remarks at the end. And I'm very happy with the final comments by the Commission. I have to say there were some points I was just writing down because I was feeling, I mentioned at some point, we are playing like a bingo during the meeting. We have all the buzzwords like communication, trust, and so on in all these meetings in a way, but there's more to them, and sometimes this is a superficial level discussion, and I think the Commission nailed it in the end, showing it's not only about the words. I'm first in Poland to say, and my office is to say, that communication with patients is the most important thing ever, and this stays true. But in cases like that, what's even more important is that I don't think we can, by explaining, convince someone to trust. I don't think that works this way. And what usually works, that words can make you not trust someone, but they cannot convince you into trusting. And the problem is we have to make people feel safe and not explain to them that they are safe. And this is something we have to do by doing and creating better systems instead of talking about what we're doing. And this is the extremely difficult part of our job when we're working on healthcare and we have the patients and their rights and their well-being basically at heart. So this is about designing the system and the solutions that EHDS or healthcare at all should be frictionless to patients. So there should be as little limit to accessing it and use it as possible, not only by explaining that there is some benefit to them. And the important part was also said by Professor Bloom on the education. So we have to start as early as possible, so we don't have to inform on whatever and try to convince people if they are already convinced when we started very early. So those are different goals than just explaining. And this is something I want to chime in for the general discussion and for the things I was supposed to say, because I think that there were some expectations for the final remarks. I would like to start by saying we were set off by our Minister of Health, Izabela Leszczyna, and Deputy Minister Katarzyna Kacperczyk on a very interesting journey under the presidency for the last few months. And I have to say, we had to learn much more about European aspects of patient rights, because we usually are very country focused, I can say, and this is similar for many similar organizations or patient organizations very often as well. I have to say that Mariano was a great navigator through the sea of the patient rights from this other perspective, and that's usually the journey is about the friends, I guess. What was interesting for us and why we started, and this is important, I feel, is that the Minister of Health took the strong interest in patient rights, but in the real life application. So not just as a concept, not something about what we talk about, because we're often saying about patient rights being the most important, or patient being the most important, patient-centric systems, about we use them both as excuse and a shield in different contexts, and this is very worrying for someone who's to advocate for patients in the very real sense to make their position in healthcare better. So we were wondering how it really works when it comes, and also MEP Sokol mentioned it very nicely, looking for the balance for patient rights and the economics of this all. Whether the patient rights are really in the heart of the process, or is it just words? And what can we do to make it being words? He also mentioned one more important thing, which I don't think we speak enough, that he said that it's unbelievable that it's unacceptable to have 27 different sets of patient rights. And this is actually the situation we are in right now, which is fascinating in a way when we're looking for the healthcare system. So what we done in the journey, because it was, as I mentioned, all about the action and not just talking. We actually started with patient organizations because we wanted to see if the need or the problems we see in Poland are the same in other countries. So not only what's voiced in the meetings for institutions like, like in here from the pan-European level, but also at the local level in other countries if the situation is similar. And we got a very overwhelming answer. We had guests from patient organizations in Krakow, in Katowice in March, from 17 different member states, and we were talking with them on their problems and whether they also see the need to look at this with the same way. And the focus of the discussion was the European Charter of Patient Rights, because we feel this is a great starting point for us to see if we understand patients and what they really need the same way. And that was one of the things we noticed, that what was mentioned by patient organizations was the lack of equality, lack of access, and lack of priority. And the patient rights, especially when thinking about them and choosing what they should be in the newer context after the document, which is a great starting point, but was done in 2002. So the system and the surroundings changed a little bit. Was something to hold off. The meeting ended with a call for action for the member states and institutions to move forward on the topic. And to move forward, this is what we've done. We had just last week another meeting. This time it was much more difficult to organize, simply because this was the first time the organizations similar to my office, to the Office of the Commissioner of Patient Rights, so competent authorities for patient rights from different member states, actually met. We actually had to use permanent representatives here in Brussels to even identify institutions which we would find comparable, who are really working with patient rights in mind. And this was the meeting we had in Gdańsk last week. We have representatives from 30 member states. And that was also a very interesting discussion. First of all, we had to meet for the first time and get to know each other a little bit. But so that was kind of a starting point. But there was an interest, because we mentioned we were talking about the Katowice meeting with patient organizations about the European Charter of Patient Rights, and there was the fair interest in this topic. We were asked questions about our next steps as a country, after the presidency, how it will work out. We decided for the moment for the meeting that the first thing is to start and work on a network. So we really have some cooperation and some closer ties with other institutions in different countries. And to get back to this topic with the subsequent meetings, there is a chance the next meeting of this governmental institutions, because that's the important part. Right? So no patient organizations, but governmental institutions dealing with patient rights. We think we'll meet again in the autumn. We were invited to Portugal for that meeting, so it might fall outside the scope of presidency this time, only because Denmark was not taking part in this meeting, but another country who's there is Cyprus. So I hope we'll get back under the presidency banner sooner or later, because the interest definitely is there. On the idea level, there is the strong feeling that this is important, that this is something that should be considered. I'm very happy I'm here at our meeting, and also took the chance to, when coming to Brussels, to discuss with some members of the European Parliament to plead to them the case for the moving forward on that topic. And this is basically the start of a journey for us. So I think that's the best way to finish the meeting.
Thank you so much. Thank you all so much for being here, especially to the panelists. As I said, we are making a video, so whoever hasn't done their interviews, please come to myself and Zoran, who's over there. But I'll hand over now to Mariam Novota for some closing remarks.
Thank you, Mariam. Thank you all. Two considerations before my list of acknowledgements, etc. One is related to a target that should be prioritized. The member of the ethic committee, they are already engaged or should be engaged. And even we listen about the stakeholder forum at European level, etc. There should be also some stakeholder forum also across in each member state. It is important that an inclusive criteria to be engaged, to be recognized as a stakeholder, and starting with, again, the ones that are already recognized member of the ethic committees, national level, regional level, European level. This is an aspect extremely relevant from my side that is not always emphasized when we talk about the implementation of European health data space. The second aspect, okay, health literacy is not only related to the digital aspect, etc., and much more cross-cutting issues, etc. But in a very pragmatic way, the experience of my country. In Italy, we have the National Plan on Immunization, in which we can find resources and activity to raise awareness, citizens, population, patients. The National Plan to fight antimicrobial resistance, again, resources, plan, activity, etc. National Plan on chronicity, etc., etc. Why we don't change the paradigm in order to leverage a national plan on health literacy, and in this case to reinforce digital health literacy. Otherwise, this is not a dream. This is just a political decision that should be taken in consideration the implementation of the European health data space. Not just to put some resources for this aspect in a silos approach, but much more cross-cutting to leverage also not to raise awareness of the citizens, of the population in general, of course, the patient advocacy groups. So this is something that I want to highlight. And in this context, also in the coherence of the name of our association, Cittadinanza Attiva, Active Citizenship, etc., we have also some concrete initiative as a next step of this meeting that I'd like to show you, because in the context of Facilitate project, it will be organized a webinar next 25 June. Please take note. And the focus is to explore progress made in return of individual participant data. Within the end of this year, probably in December, hosted by Member of European Parliament Andrew Kaitis, it will be organized here again at European Parliament, a policy dialogue meeting, an opportunity to present the ethical and legal framework developed by Facilitate project for the return of data data to clinical trial participants. This is something. A part of it, we are interested to involve our constituency, online survey to identify barrier difficulties in accessing digital health, advocacy sessions, but also training focus on two different aspects. In the context, so the value of sharing data in the context of health conditions, starting with people affected by rare disease, but also initiative in the context of prevention with a focus on the value of sharing data, health data, in the course of public policy on vaccination. This is something that we'd like to be much more engaged, and we are planning to put in place. Another aspect, member states receive a lot of economic public resources for the national recovery and resilience plans to digitalize our healthcare systems. What is the state of the art? What we have achieved thanks to these public resources? This is something that we are not so aware, and this again is a national competence. Public money, but also European Commission should be very, very aware about this kind of resources as being applied, used, etc. So this is something that we'd like to highlight in a very concrete aspect, And now, yeah, if you comment, please, Madam, because it's extremely true that we have received the member state resources to digitalize, and then at the end of the day, we are not so aware about it. I have finished, but I have my list of acknowledgement to say thank you, someone. I think thank you all, of course, starting from all of you attendants, starting, if any, I don't know, connecting remotely. Thanks again, Benifei. Thanks, Mariam, all the speakers. I want to thank the Polish institutions in the person of the Minister of European Union Affairs, Adam Slapka, sorry for the pronunciation, who decided to grant the patronage of the Polish presidency of the Council of European Union. So this event became part of presidency calendar, but also thanks to the Polish Commissioner for Patients' Rights, Bartłomiej Chmielewicz, for also granting the honorary patronage. But again, for their political decision to put the topic of European the patients' rights, the protection of patients' rights in the European legal framework at European level. Let me remember that this European Policy Dialogue event was made possible thanks to the EU-funded project Facilitate, that is the acronym of long statement, framework for clinical trial participants data utilization for a fully transparent and ethical system, but also thanks to the unconditional support of Pfizer, Boehringer Ingelheim, and Viatris, which I would like to thank. Thanks also the three media partners, Health Europe, Trend Sanità, Policy and Procurement in Healthcare, and MedWeek's publication, publisher of the peer-reviewed Journal of Medical and Clinical Case Report. And as always, please let me thank my colleagues, especially, where is Daniela? Daniela, okay. Where is Bianca? Veronica as well, and all the colleagues that work in Italy. And of course, all the documents related to this initiative will be widespread in our website and monthly newsletter. For today is all. Thank you again for your attention. Have a nice rest of the day.
Sorry, I think they just come in. Yeah.
Thank you. Thank you, Mariam.